The cells that cause multiple myeloma live in the bone marrow, so inside the bones. And what's unusual is that those cells make an abnormal protein that floats around in the blood. And so when patients have multiple myeloma, there's some damage that goes on in different organs of the body, either directly due to the cells growing in the bone marrow and/or this abnormal protein that's floating around in the blood. Multiple myeloma can cause a lot of different issues in the body, and for different people it causes different problems, but some of the more common things that we sometimes see are probably bone pain or broken bones that occur under unusual circumstances. And this isn't the kind of thing of, you're out in the yard yesterday, lifted a bunch of branches and a bunch of yard work, and then today my arms are kind of sore. It's more, pain in some location where I don't really remember doing anything. It's been a couple weeks, it's getting worse. I have never had anything like this before. So I'd say sort of red flag bone pain of that type. Low blood counts can be a red flag. Often people won't feel that, but especially if hemoglobin is low, so it's severe anemia or low blood. People can often have shortness of breath or fatigue. Those are probably two of the major symptoms that people can have, but there's any number of other ones that people can also have. Most of the things that predispose one toward developing multiple myeloma are really things that we can't control. So the biggest sort of risk factors, for lack of a better term, are age. So being older carries a risk or increases the risk of developing multiple myeloma, where the average age of diagnosis is about 70, so it's almost unheard of in young people. Males have a predisposition as compared to females. It's not a very strong one, but males have a higher rate of developing multiple myeloma. And then certain ethnicities, including African American ancestry, also carries with it an increased risk of developing multiple myeloma. Again, not a huge difference, but there seems to be an increased risk there. And the reasons for these disparities isn't totally clear from a biological perspective or any other, but for what it's worth, that's, epidemiologically speaking, those predispositions exist. Here at UNC, I think we've contributed significantly to myeloma research in a couple different ways, and probably the two biggest ones are through developing new medications and then through what we call observational research. So in terms of developing new medications, we develop new agents here in the lab in collaboration with various researchers at Lineberger, and that's tremendously exciting. So we have technicians working in the lab on developing completely new agents for treating this that we hope will cure this. UNC has a world-renowned CAR T program, and so we have a multiple myeloma CAR T study and others hopefully coming, where again CAR T is tremendously promising in multiple myeloma and other forms of blood cancer, and so we're trying to improve upon that here at UNC. And then we also collaborate quite a bit with other academic institutions and pharmaceutical partners on agents that they may be developing. So we're a major referral center and participant in different clinical studies looking at agents that are being tested, again in clinical research for patients with multiple myeloma. There's a lot of reasons to be hopeful, because these days people diagnosed with multiple myeloma most often will live many years with the condition and live well. Our treatments are more effective than ever before. And so there's a lot of reasons to be hopeful. And sort of on that note, one thing that I would really encourage people to do who are diagnosed with multiple myeloma is to be seen at a specialty center. If it's UNC, if it's elsewhere, it doesn't matter, but go to see somebody who specializes in multiple myeloma. And the reason for that is that the field has become incredibly complex in the last 10 years especially. There are many, many different treatment options, not a lot of clear guidelines or pathways on what's truly the correct option number one versus number two, and when do we do transplant and all these different things. There's really a long-term strategy to this and things that can be done that really maximize the chance for living a long time with this and maximize quality of life. So minimizing symptoms from therapy, minimizing issues related to multiple myeloma. And we specialists who do this full time really can help to do that. Multiple myeloma is about 30,000 new cases per year in the US, so it's sort of medium common, but that means that most people who have multiple myeloma have never heard of it before they developed the disease. And so I think having awareness of this is important, and then supporting the work that we do through research and philanthropy and things like that, in the sense that we're working on making this better, developing new medications, again, hopefully working toward the cure for this, but obviously that sort of thing takes resources and funding, and so we need everybody's help to get the job done and hopefully get to the cure with this.